It is not very uncommon, right, for a patient to walk into our practices and there is a click in the TM joint, and this could be a painful click, and you are wondering what can I do to help that patient. If you are thinking, let me just give this patient a night guard or a soft splint, it is not going to change anything for the patient. On the contrary, may worsen the symptoms. So look here, I'm giving you a patient who on opening has a painful click. Each time this patient opens the mouth wide, there is a click in the temporomandibular joint. Now what does that click mean? The click means this patient has a displaced disc. Each time an individual opens, the disc gets captured, and that is when the click starts. So look closely. This is where there is that click sound, where the disc comes back on top of the condyle, but the problem is as the mandible goes back, the disc slips out again, and each time the patient opens, there is a loud pop that could be painful. So how do you manage this case? If I were to ask my patient to bring the jaw slightly forward and then ask my patient to open and close from that point, this is a slightly protruded position. Patient opens and closes and the patient has no clicking. What this basically means that when I ask my patient to bring my jaw forward, the disc has come back on top of the condyle, and now opening and closing from that arc does not cause the patient pain or clicking. So what do? I consider that jaw position as my therapeutic jaw position, and then I give my patient an anterior repositioning splint. That, my friends, is the answer for a loud, painful click. What you see here is a small ramp that is designed to bring the mandible forward each time the patient closes the mouth. So here, as the patient begins to close in MIP, the ramp guides the mandible forward into its therapeutic position. Now there are some rules. How much can the jaw be brought forward? For how long should the patient be wearing the splint? How many hours a day? The duration of splint wear. All of that separate. But once these norms, these rules are followed regularly, you can reach a situation like this, where at your normal bite position, on wide opening, there is absolutely no clicking, no popping in the joint, which basically means we have been able to capture the disc, and then we bring the jaw back to its neutral position, holding the disc in its proper position, which means we have eliminated the click, we have reversed the structural breakdown. Now, it's not like all cases will respond this way. There are certain thought processes that a clinician needs to understand before committing to such kind of treatment. Now, if you are someone who's keen on helping patients who have painful TM joint clicking, then guess what? I have an offline course that is an in-person course that is happening in the month of January of 2024. Go ahead and put in a request in the comment section and my team will share details of the same with you. If you cannot travel to Mumbai for a 4-day event and yet want to learn how to manage this, you can do this from the comfort of your home as well. All you need to do is log into mikeducation.com, and there is a TMD full course which is titled From Confusion to Conclusion. And remember, if you are someone who wants to get splints fabricated, the details are here. MIK Splint Lab fabricates these splints for dentists. And of course, remember, I am here at Smile Masters in Bandra West. In case you want to reach out to me, feel free to do that. Continue to take care of those TM joints.